I'm going to show you how to use this ball to alleviate low back pain while you're pregnant coming up. One of the fastest and most effective ways that you can alleviate pain in your body is to roll around on a ball. And we have a group of balls, including a soft ball and then firmer balls, so that you can just kind of work with the different levels of tension in your body and not freak out your nervous system by using a really firm, hard ball to begin with. In this practice that I'm showing you, we are using a small ball, about the size of a tennis ball, so that you can work directly in the muscles along the spine and then in the low ribs and then in the low back itself. And it takes a little bit of good teaching to learn that skill, to get right into the source of the pain that is coming up in your low back for you in your pregnancy. Now, in another video, I talked about how pregnancy creates a hyperlordosis, or a big strong pull in the low back, and kind of squashes this muscle that goes along the lower spine called quadratus lumborum, and then all the erector muscles in the back that go from the top of the pelvis all the way up to your head, really. And so you can use this ball all along those muscles to locate where your body specifically is holding tension that's causing pain in your back, and then how to release it, and then some particular stretches to do afterwards so that you can kind of train the muscles to a new length and help them to feel easier. So you're going to want to go through this whole video using the ball, finding the tension in your body, breathing, softening, sinking, and releasing that tension so you can get yourself out of pain. And you can get yourself out of pain. You just need to have a little bit of skills. So you're going to want to grab a ball about the size of a tennis ball and come to the wall, and we're going to show you real specifically how to take care of that low back pain. We're going to use a tennis ball sized ball. You can use a myofoam ball, yoga tune-up ball, FreeBody ball to release some tension and trigger points in those muscles that run along the spine and even out along the ribs. It's going to feel amazing. So I'm going to hand this ball to Morgan, and I'm going to show you that she begins standing close to the wall. You're going to take that ball and put it behind your back, next to the spine, but not on the spine, okay? Now, the closer you stand to the wall, the less pressure on the ball. So you're going to cross your arm over. And I'm going to have Morgan cross her arm out of the way just so that you can see the ball. Your arms can be just relaxed down by your sides. And then Morgan can step a little bit away from the wall. And as she does that, her body weight sinks back into the ball, and that increases the pressure. So you can increase the pressure by standing further away from the wall, decrease the pressure by standing closer to the wall. And then now bend your knees a little bit, Morgan, and then notice that's going to help the ball roll up. And then to straighten the legs, the ball rolls down. So you're just going to play with that for a little bit. As you're on the right side of the spine, you can kind of wiggle your body a little side to side. You'll find that if you turn your body slightly toward the right, and even turning your feet a little bit toward the right, that kind of angles that ball about 90 degrees to the tissue, which is really the most effective angle for releasing tension in your muscles. So how's that feeling?
Great.
Yeah, great. Yep. So you can feel that as you're moving up and down near the spine, these muscles, the erector bundles, they're called, that hold your spine erect, are getting really kind of stressed out, especially later in pregnancy. And so they're loaded with tension. It feels so good to roll them. And I want you to find one spot that feels like particularly kind of tender. And then once you find a tender spot, just relax your body here. Let all your muscles relax. Take a couple of nice breaths. And so we just need to allow the ball a little time to do its magic. We're sending a message into the nervous system saying, it's okay, baby. You can relax this tension. It's going to be all right. And so we give it a few breaths, and then we move on. Start rolling, moving around a little bit. And I actually, let me see where that ball is. Yeah, good. So she's got it in that spot just above her low back, just above the lumbar spine. That is an area in the lower ribs that gets holding a lot of tension, yeah, because you're pivoting from a lot of movement in the lumbar spine where there's a big pull to very little movement in the area where the ribs are. So now we're going to see that ball right at the top, the lower ribs, just at the top of the lumbar spine. And then you're going to kind of rock a little side to side. You're going to feel that ball bump a little bit into the spine, but not over it. And then rock your body to the left and feel that ball going out along those lower ribs. And you'll probably find a really tender spot out along those low ribs, a little wider away from the spine. Do you have that spot, Morgan? Is there a tender spot out there? Yep. So you're going to rock your body to the left, get that ball out a little wider along that low rib, and then you're going to stay there and just kind of hang out, relax your body, soften your jaw, soften your eyes, because when we hit those tender spots, it can create a little bit of stress in the body and in the nervous system, and we want to make sure that we're relaxing and softening the nervous system as much as possible to release that tension. And then we're going to bring the body back to center and just kind of going up and down there a little bit along the spine. Mm-hmm. Great. And then we're going to get that ball lower and even like toward the bottom of the lumbar spine, because as you bend the knees, the ball goes up, right? So just going right there, up and down, right along that lumbar spine feels so good-ish. It feels so good-ish. Mm-hmm. And just the balls are magic. They can really help alleviate accumulated tension, and that accumulated tension is what causes pain in the body. So now I'm going to ask you to turn your body a bit to the right again. Mm-hmm. And then I'm going to have you step your feet a little wider away from each other. So the feet go a little wide away from each other. Feet are pointed toward the right. Yeah, so that she's a little bit turned sideways. And then we want that ball kind of in what used to be the soft side of your waist, right? And then you're going to shift your weight from foot to foot. And so as you go toward the back foot, the ball comes out into that soft part of the waist. And as you rock your weight into the front foot, the ball goes back and kind of hits right next to the spine. And often you'll find some tension there. So once you kind of anchor next to the spine, you can go up and down again. And this lumbar area, this muscle along there, quadratus lumborum, that helps to keep your pelvis balanced, that stabilizes your lumbar spine. It gets full of tension in pregnancy and can also lead to not only low back pain, but SI joint pain, sacroiliac joint pain, hip pain, stuff that can feel like lightning-like tension along the sacrum and deep ache in your butt. So all of those things are things that we can address with this right here. And so just kind of rocking back and forth, finding tender spots along that lumbar spine. And if you're not sure if you're in the right spot, in a lot of ways, it doesn't matter as long as you're finding some tender spots to work with, right? And you probably have a few tender spots to work with. So I'd like you to find one more tender spot to work with along that low spine in that area. Mm-hmm. And get that ball kind of pushing at the side of the spine. Mm-hmm. Yep. And if you keep your body turned to the right, it's going to allow that ball to get in there even a little bit more. Yeah. You feel how that kind of allowed it in there? And then you're going to find a tender spot along that lumbar spine. And then you're going to do little tiny side bends side to side. So just kind of bending away from the wall. It's going to pull it, make it a little more exciting, and then bend back toward that side. And just rocking side to side. And you can repeat this process through that whole lumbar spine area. So maybe we'll just do one more side bend to each side, bending toward it, and then bending away from it. And then just coming back to center. And then just go up and down, whatever you feel like doing. It's always nice to just kind of do a little bit of extra at the end. Great. Releasing gluteus medius at the wall is really simple and super highly effective for alleviating all kinds of conditions. Restless legs, pain in the sacrum, hip weakness, a lot of issues that come up in pregnancy. So you definitely want to use your soft ball. And I'm going to ask Morgan to turn and face that back wall because I'm going to show you where these muscles live, right? So here's the sacrum in the middle of the pelvis, right? And then the top rim of the pelvis. So yes, it feels good to roll your whole butt at the wall for sure. But these trigger points that cause this pain and dysfunction live at the very top rim of the pelvis. So Morgan's going to be rolling along this top rim to alleviate those trigger points. So you want to start with your softest ball, that nice soft air-filled ball. And Morgan, I'm going to hand you the ball and you're going to step your butt back to the wall. And you'll want to begin with your butt at the wall and your feet just a little bit away from the wall. And just like any other rolling at the wall, the closer you stand to the wall, the less pressure. And the further you stand away from the wall, the more pressure you'll feel in the balls. So stepping your feet about hip distance apart or a little wider. And then she's going to roll the right side of her bottom. So she's going to turn a little bit to the right, keeping those feet a little bit wide apart. And so now, Morgan, go ahead and take that ball and place it on the top of your right buttocks, kind of near the sacrum. And then bend the knees a little bit, kind of play with like finding that spot. And then she's just going to rock her weight side to side. When you begin this work, shifting your weight side to side and just cruising along that top rim of the pelvis gets the tissues warmed up and kind of ready for more specific trigger point release. You'll want to do that for about 15 or 30 seconds to get the tissue ready for the specific release work. How's that feeling? Good, great. So now you're going to get that ball really close to the sacrum, just on the outside of it, what's called the SI joint. And Morgan's wonderfully keeping her hand up on her baby so that we can see where the ball is. You can just keep your arms relaxed by your sides. And then did you find a little specific spot? And so now you just kind of sink into it, relax your jaw, nice breaths. Breathing as deeply as possible, late stage pregnancy or any time in your pregnancy. And then just giving that trigger point, that tension, a little time to release. And you might start to feel it get a little bit softer, a little bit easier. And then there are kind of three main trigger points along this trajectory, along this line. So now you can maybe scoot the ball a little bit out to the right a little bit, and then you'll rotate your pelvis a little bit toward the wall. That's going to get that pressure about 90 degrees to the tension. Feel that got more specific, right? Just turning that, rotating that pelvis a little bit. Breathing. Check your whole body. Are you as comfortable as you can be in this position? Do you want to adjust your feet? Just making sure, that you feel well supported. And then after a few minutes here, a few moments here, a few breaths, then just kind of moving up. Maybe it would feel good to kind of rock back and forth again, following along that trajectory of the top rim of the pelvis. And then for the last point, you're going to rotate your body a little bit closer, like toward the wall, and then readjust your feet so that both knees can be bent. You feel well supported. So we want her to be just not quite perpendicular to the wall, but just before it. What's interesting about this point is that the further away you get from the center of the pelvis, the more this pain radiates at the center of the pelvis, so right on the sacrum. If you're having sacral pain, feeling like you kind of got kicked in the sacrum or fell in the sacrum, this is the point that's really going to help with that particular pain, as well as all the other conditions that we've spoken of. How's that spot feeling? It might feel kind of good to just like bend and straighten the knees a little bit, kind of go up and down, making sure that you're right on the sort of apex of that tension spot right there. Good, right? Mm-hmm. So we'll just take maybe 2 more breaths here. And always just checking, can you relax the rest of your body and soften your shoulders, soften your jaw. Mm-hmm. Great. And then to complete this side, you'll just go back and forth side to, kind of rolling across that top rim again. Great. And then I just want to see how this has affected the strength in either side of her hips. So Morgan, you're going to come away from the wall. Great. And then you're going to bring your hands to that wall back there. Okay, great. And then you just release that right side. So I'd like you to kind of take the right leg out to the side, just kind of a little bit of a leg lift out to the side, see how that feels, and then lower it. And just do that 2 more times. Lift and lower. And then lift and lower. Great. And then bringing your hands to that other wall, now bring your left leg out to the side and see if that feels so much lower, like a full foot lower, because she still has some tension in that glute med. So great, Morgan, thank you. So you're going to turn around. Let's release that other side so that you can be a little more balanced. So again, bring your bottom to the wall. Rolling the left side, you want to turn your body slightly to the left, stepping in closer for less pressure, stepping in further away for more pressure. And then just cruising across that top rim of the pelvis, just to warm up that tissue. Back and forth several times. Checking your breath, keep breathing, not holding your breath. Sometimes the points can feel really exciting and spicy. So there might be a little like, oh, wow, there's something there. So just making sure that you release the breath and keep yourself breathing. And then now that it's been a little bit, you can feel the tissue kind of starts to change. It's ready for the ball to go in more specifically. So you're going to get that ball right next to the sacrum. And then just kind of wiggle around a little bit until you find that real specific point. Mm-hmm. And I can see when Morgan gets it because she's like, oh yeah, that's it. Yeah. And then just a couple of breaths here. Mm-hmm. It's common to feel one side more tender than the other. And it's often the side that you're having more weakness on or more kind of hip issues on. You might feel more tenderness on that side. Mm-hmm. And then after a few breaths, now you kind of move your bottom back, bring the ball out a little bit more to the side, turn your body just a little bit more toward the wall. Morgan's doing a great job. And then you'll go, oh, there it is. There's like another spot. And you might have to go up and down a little bit to just make sure that you're right on that spot. Yeah, right? That helps, right? To just like, oh, there it is. I've yet to meet a pregnant woman that doesn't have any tension here in these areas. This muscle specifically is really working hard to stabilize the hip joints. And as we know, late in pregnancy, the hip joints get less and less stable. So these muscles end up tightening and working really hard, causing all kinds of issues. So now we're going to go to that third point, maybe rock a little bit around, start to turn your body almost perpendicular to the wall, but not quite. And maybe doing a little up and down, just making sure that you're at the top rim of the pelvis. And then finding that third outer point. Again, this one referring mostly right into the sacrum often. You may not feel those pain referrals while you're doing the work. You might. But you'll maybe be feeling it through the rest of your day or when you're trying to sleep at night. Maybe one more nice breath here. And then it's always kind of nice to do a little bit of back, side to side again. And so then you'll come off the wall and let's do that little check again. Let's see if Morgan's leg lifts higher. So go ahead and hands to the wall. And then we're going to lift that left leg up so much higher, like literally like a foot higher. The muscles, that just releasing that little bit of tension, already it makes them stronger and more capable of doing their job. Great, and so that's it. That's releasing gluteus medius. And now we're going to end with a little bit of stretching and movement for these muscles to kind of help settle in this new information that we've been putting into the muscles. After you've finished your rolling, standing, coming up to standing, bend your knees a little bit, place your hands on your hips. The elbows can bend back toward each other, just getting that little bit of extra opening in the chest. And then you're going to move through what we call standing cat-cow. So you're going to tuck your pelvis under, and you can kind of curl in a little bit, and then tilt, squeeze the elbows, and then tuck under, and squeeze the elbows. We'll do that 2 more times, tucking under. And so what we're doing is just kind of retraining the muscles with this new information that we gave them with the rolling. Great. And then you're going to come up to stand.